Good morning, good evening everyone. Hopefully I am audible. So this is our annual webinar that we do at the start of the interview preparation season, and we'll talk about what the season entails, how you should prepare for it, and what are the typical pitfalls. This is obviously open to anyone and everyone, and we'll post it on our YouTube channel as well. So why the interviews are so important, make or break, some of the important questions, and then typical mistakes that IMGs tend to make. And of you who don't know us, our team helps you in almost every phase of the USMLE other than the exams. So whether it is the rotations, whether it is obviously the RAS application, personal statement, program outreach, which programs to apply to rotations, interview preparation, of course, that is why we are here today, post-interview communication, and of course SOAP, and eventually the final match. Before we get started in terms of the interview preparation, how we go about it, there are obviously mock interviews, there are classes, there is one-on-one advisory, we help you in rank order list, program outreach, we do it in a closed Telegram group, and we also have program specific guidance and interview preparation. And we are now, of course, enrolling. For those of you who may be interested, you can reach out. The interview day, what to expect, and some of the typical questions. So I think, Rana, that's you're going to talk about some of this.
Yeah. So some of the things you can expect when on your actual interview day. You would have received an email. You would have you would have arranged how to get there by your interview day. When you first get there, they're going to try their best to make you comfortable. So everyone is going to be friendly. The program coordinator will probably introduce herself or himself. They're going to give you a presentation on their program. So they're going to try to ease you into the interview process. So whatever reservations you had when you first went in, they're going to slowly start dissipating. Then the actual interviews begin. There's usually at least 2, sometimes up to 5 to 6. Each interview is similar. And I've noticed in all the interviews that I've went to that there's 2 types of interviewers. One of them would be the type of interviewers who have gone through your profile. They like you as a candidate, so they're just going to kind of reiterate everything that's in your CV. They're going to just ask you, tell me about yourself, and you're just going to have to go through whatever you've written in your profile. Then there are those interviewers who kind of, I guess, they operate a little bit on the deficiency model. So they have some kind of reservation or some kind of question on your application, and they're going to focus on that. So I'm just going to give you a list of things that you can expect that will definitely be asked, and some other things that you may be asked. So the first set of questions are the questions that they ask to kind of get to know you as a candidate. The most typical one is tell me about yourself. You can expect this in every single interview. By the time you're done with your first 2 or 3, depending on how many you get, this answer will be, this is an answer you should prepare. Tell me about yourself. They might have a specific question based on your personal statement, or they might just leave it out in the open. So you should have an answer for this. Another typical question you can expect is what made you apply to our program? Again, depending on whether this is a community or a research program, you would want to tailor your answer to that. They'll ask you why you like the specialty, your chosen specialty. Again, this is a little bit of a hard one, but this is, again, a question that you should have a ready answer to. Why do you like internal medicine? Why do you like pediatrics? Another typical one that I found was asked a lot was explain yourself in a leadership role. There's a big focus these days on doctors taking up leadership roles. They want to know if you're one of those, or if you have an idea of where you think your strengths lie and where you would want to take a leadership role based on what you've done in the past, based on what your interest is. So this is something you should have a fair idea of. The other thing is gaps in your resume. If you have a lot of if you have years and years of, a gap, or you're many years out of your medical school, then they'll ask you to explain those gaps. I guess what they want to hear during this time is that you were doing something productive. They don't really like to hear that you spent a year studying for your USMLEs. So you can say that you spent some of that time studying for the USMLEs, but also try to get some, try to fill in those gaps with clinical work. Another one that I was asked in almost every interview that I went to, whether it was for residency or fellowship, is where do you see yourself in 5 years? They kind of want to get a sense of whether their program is good for you in terms of what your career goals are, and whether you have a plan. It's always okay to say that this is what I think I want to do. It might change during residency, which is expected, but you should still have a fair idea of where you see yourself in 5 years. Do you want to be working at an academic center? Do you want to be, the head of department somewhere? Do you want to just be, do you want to be a primary care physician working in, a rural setting? You just should have an idea, and why. Another question that I was asked a lot is, why did you choose New York, or why did you choose, Michigan? Wherever you're interviewing, why did you, like if you get an interview in South Dakota, why did you choose South Dakota? A lot of people, as IMGs, sometimes we apply very widely. We don't think about, we're not too selective. But a lot of the interviewers, especially if you go to places like, maybe the Midwest in South Dakota or something like that, they won't understand that. They think that you have really thought it through. So wherever you're going to apply, you should kind of have an answer about why you chose that particular area. Another question is, fellowship or primary care. Obviously, you want to tailor this answer a little bit to where you're interviewing. You don't have to say I'm not interested in a fellowship at all. If you're going to a community program, you can just say that yes, I'm interested in this, but I want to, I want to use the patient volume, or I want to get the experience of a community hospital and apply it to my fellowship. It all depends on how you tie in everything to your future career goals. And the last one is obviously hobbies. This is a lighter question. They'll discuss, what you've written as your hobbies, why you enjoy doing it. This is something that usually you're able to talk about. So these are the common questions that they're going to ask you to just kind of get to know you as a candidate. The second set of questions that they ask is sort of to get a sense of your character and your integrity. So a common question that I was asked is a mistake that you made and then you learned from. You want to be honest here. You don't want to make it seem, like my mistake was working way too hard, because that's not really a mistake, and they look for that, they listen for that. So you want to be honest. You obviously don't want to make it sound like some kind of horrible mistake where you compromise patient safety or something, but a genuine mistake and what you learned from it. They want to hear how you overcame it. Obviously, 3 strengths, 3 weaknesses. This is a question that most of us know that will be asked. I've found that programs these days are kind of tailoring this question into something more specific, but I have been asked this from time to time. Another question that I was asked in a number of programs was a difficult situation that I faced, and how was I able to overcome it. So this is a little different from, a mistake that I made, just any difficult situation, whether it was, a conflict at work. There's a lot of questions these days that are kind of focused on conflict management. A conflict with a superior, how would you manage it? Or a question I was asked was that your senior made a mistake and there's a medical student there on the team with you, how would you handle that situation? So they just want to see how your conflict management skills are. Then another kind of question that I've been asked is, I'm not sure why they asked this, maybe it's a little bit of, to get into your psyche. If you could write a book on anything, what would it be? And of course, you can't, these are just one of the questions I was asked. It's not, you can't really prepare for this. You're going to have to do some on-the-spot thinking. But just anticipate you might be asked a question like this. Another one I was asked is, if you could meet any character, live, fictional, dead, who would it be and why? So I think they just want to kind of get a sense of, just the way you think. And I've also been asked, if you could be any animal, then what would you be? So I feel like these are some psyche questions that some programs like to ask. The last set of questions that usually programs won't go to this, but they might, is where they kind of assess your medical competency. The most common one is an interesting case. A lot of times this is just to see how you present the case and how you kind of thought through it and all of that stuff. This is one that you should have ready. Sometimes they're even more specific and they're like, oh, tell me an interesting ID case that you saw. Or tell me an interesting, depending on who's interviewing you. So, just have a little bit of an idea of an interesting case you want to present. Maybe a case that has some aspects of every specialty in it. Sometimes, IMGs especially, are asked about their electives. There are interviewers out there that know that sometimes, IMGs go for paid externships and they go for, paid experience. And I was asked this in one of my interviews that, a lot of these experiences are paid. How would you explain that? So you can always say that, it doesn't really, how you get as an IMG, it's difficult to get experience. So you get experience in the way that you can, but what you do with it and what you make of it depends on you. And I think they're okay with that answer. They will understand. Then another question is on the research that you've done, research that you're planning on doing, and how you're planning on continuing this research as you go on. So this is, this depends on you, what you've mentioned in your CV, what you've already done. Just be ready to talk about your research and the results. You're often asked on the EMR to see if, if you've ever worked with an EMR, if you'll be able to learn. That again is pretty much a yes/no question. Sometimes they'll ask you about your LORs. They'll say you've gotten very strong LORs. What do you think? What do you think that you did that that made someone write such a strong LOR for you? So again, they're just trying to assess your medical competency in that way. So yeah, I think these are the most common questions that I've encountered. Obviously, when the interview prep starts, if you were to join, then we would go over some of these answers. But these are some questions you can expect to be asked.
Thank you. Okay. Thank you very much, Anna. This is very comprehensive. I appreciate it.